A very good evening to all the viewers. Welcome to the IGCP chat show on Doxycycline, the forgotten weapon for summer infections. There are some infections that are more prominent in certain seasons than others. In summers, the rising temperatures are ideal for pathogens to thrive and spread. And in this era of increasing incidence of infection and antimicrobial resistance, medical management becomes a challenge. So I welcome Dr. Behram Pardiwala, consultant internal medicine, coordinator, Department of Internal Medicine, head of Internal Medicine, director academics, Wockhardt Hospital, Mumbai, to share his valuable insights relating to the infections commonly seen in summers and the treatment strategies. I welcome you, sir. Thank you so much for joining us today. Sir, so starting with, what are the infections that are commonly seen during the summer season?
Okay, thank you, Shweta, and I thank USP for asking me to talk on this platform. Primarily, if you look, there are four or five things that you should see during summer infections. One is what we call fever of unknown origin. Second is traveler's diarrhea. The second thing is typhoid fever and urinary tract infections. These are common things that occur during summer.
Okay, so sir, since you mentioned about travelers' diarrhea, what are the major reasons of its occurrence, and what is the need for antibiotic prophylaxis? Is there a need for antibiotic prophylaxis in travelers' diarrhea?
Look, it's like this. Whenever you travel to a different country, you're exposed to different water, exposed to a different environment, you're exposed to different bugs, which your microbiota may not be able to cope with at that stage. That is why you get what is known as a traveler's diarrhea. It's a diarrhea which occurs within 24 hours, 36 hours of visiting a new country or a new place. The question is that a lot of studies have been done whether you need to take prophylactic antibiotics or whether you need to treat it.
Hmm.
Normally, it used to be said that it would wear itself out and in 2 or 3 days the patient would get better. But remember, when you are traveling for 2 or 3 days, it takes too much time. So much time is wasted. Therefore, people started talking about giving antibiotics as treatment for traveler's diarrhea.
Hmm.
Subsequently, there were reports coming in from Mexico. You know, Mexico is a country where you have a lot of foreign tourists coming in, and in Mexico, traveler's diarrhea is very rampant. So they had two sets of treatments. They had gave prophylaxis to one group, and they gave treatment to one group. And they found that the symptoms subsided within one day in the treatment group. And in the prophylactic group, almost 75% of the patients did not get any symptoms, which proved that both the situations work. If you give prophylaxis, you don't get the infection. If you get the infection, you give treatment, you get response. And the drug that they used was doxycycline. Now, doxycycline is an old hat drug. It is a tetracycline derivative, but it seemed to work very well.
So, sir, here I'm just highlighting the point that prophylaxis is important for travelers' diarrhea, since studies have also proven it, and then there are studies that have said that prophylaxis is important for travelers' diarrhea. So, sir, since you mentioned yes.
No, go ahead, go ahead.
Yeah, since you mentioned about doxycycline working very wonderfully in travelers' diarrhea, how does it limit the progression of diarrhea?
But it's very simple. You know, uh, what is surprising, and that it surprised me also when I started reading this, is that despite the high transit time which occurs in traveler's diarrhea, the drug seems to work very well. A lot of absorption occurs, and it's very good as an antimicrobial. So, a small dose, when given over just one or two doses as a treatment, and given earlier as a prophylactic, seems to work wonderfully. So, it's a very good drug to use in that sense of the term.
Okay. So here in as a prophylaxis, doxycycline, and for the treatment of traveler's diarrhea, doxycycline does work wonderfully. And I thank you for sharing such a wonderful insight on it. Sir, moving on to the next infection here, I would like to know about cholera. What are the causes of cholera, and the reasons for efficacy of single dose of doxycycline in cholera?
Well, it's very simple. The cholera is caused by Vibrio cholera, right?
Hmm.
I mean, there's no other cause for cholera, and obviously it comes in because of fecal-oral contamination, contamination of the sewage lines, and once cholera occurs, you know, Shweta, it's wildfire. It spreads in the community.
Hmm.
Suffice it to say that treatment of cholera until now was very difficult, and because it's an exsanguinating illness, it just removes all the fluid from the body, and you have no fluid left, and people just die, especially the older ones and the younger ones, because of exsanguination and total dehydration. I personally have given up to 10 liters in 24 hours to 15 liters in 24 hours to patients of Vibrio cholera diarrhea. Initially, we didn't have any medication as such. We did use tetracycline when I was a medical student or when I was a registrar in KM Hospital. But now we found that a single dose of doxycycline works wonders. And what is really shocking to me is that when a person is having 20 motions a day,
Hmm.
a single tablet given orally
Hmm.
gets absorbed enough to prevent the diarrhea, which never ceases to amaze me as to how this occurs. But it does occur, and it works very well.
So, sir, what is the duration of the single dose? So, just one single dose does the trick, or you have to give it for the single dose for a certain period of time?
I think that up to 2 to 3 days you can give the single dose for, and
Okay.
it works extremely well in it. And the
Oh,
dosing could vary anywhere from 200 milligrams to 400 milligrams depending upon your response.
okay. Okay.
Yeah.
Okay. Okay. So, cholera is, a very rampant
Yes,
infection.
but
And
it's eminently treatable. That is what is surprising.
yes. Yes, and that doxycycline does have single dose of doxycycline does show a lot of positive results when it comes to limiting the
It seems to be a
progression.
very good drug for that.
Yes. So, sir, I would also like to know about acute undifferentiated fever. What is acute undifferentiated fever, and what are the challenges with diagnosing this condition?
You know, Shweta, we get this condition very often in patients.
Hmm.
What we call fever of unknown origin is now acute undifferentiated fever, in the sense that you cannot really find out what it is due to,
Hmm.
right? It could be because of a virus, it could be because of a protozoal infection, it could be because of a bacterial infection. But most of the signs and symptoms are so lacking or so common that you cannot really pinpoint it down to something. And you cannot go on investigating the patients ad infinitum, trying to come to a diagnosis. And that is why it becomes very important that you should have one drug which can work empirically on these sort of patients, right? And basically, the definition of this is any fever which lasts less than 2 weeks,
Hmm.
occurring in a patient without any diagnostic possibility during that 2 weeks. It could be anywhere from scrub typhus, it could be anywhere from dengue fever, it could be anywhere from a protozoal infection such as amoebiasis, or it could be dengue, it could be malaria, it could be respiratory tract infection, which could be viruses in nature, it could be any of these. So
Hmm.
one common drug that seems to work in all these, is doxycycline, given empirically. So when you
Hmm.
give empirically in some of the viruses in the respiratory tract, it seems to work. It seems to work especially in the tick-borne infections because it is the sine qua non, it is the drug of choice when you look at any rickettsial diseases. And even for that matter, for typhoid, it's very good.
So, sir, if so, since you mentioned about empiric therapy and doxycycline playing a role in acute undifferentiated fever, can you highlight on how exactly does doxycycline limit, or is started as an empiric therapy and does show positive results? How exactly does the mechanism take place?
Well, look at it this way. What exactly happens when you have this undifferentiated fever? You have a release of a lot of cytokines, such as interleukin 1, interleukin 6, interleukin 8, and you have tumor necrotic factor, etc., which are released. All these cytokines uptitrate the hypothalamic thermal center so that the temperature rises. Doxycycline somehow seems to down titrate the thermoregulatory factor. And how does it do that? It does that by reducing all these cytokines, such as TNF alpha, IL 6, IL 1, any of these. It tends to bring them down. And because it brings them down, obviously the temperature also comes down. Irrespective, that is why, irrespective of the type of fever, the etiology of the fever in this sort of a condition, it seems to work.
So, sir, is it appropriate to say that it has anti-inflammatory action, and since it
Well,
works, yeah.
because it acts against the cytokines, it's obviously
Hmm.
anti-inflammatory in nature because the
Yes.
cytokines are the inflammatory pathway, and if
Hmm.
anything that acts against it is going to be an anti-inflammatory drug, and this
Hmm.
is perhaps one of the simplest anti-inflammatory drugs.
Hmm. Hmm. Yes. Yes. Okay. Great. Great, sir. Thank you so much for wonderfully explaining the mechanism of doxycycline here in acute undifferentiated fever. Sir, moving to the next infection now. So, what are the causes for rise of incidence in urinary tract infection in summers? We are seeing a lot of cases of urinary tract infections increasing. So, what is the cause behind it?
Primarily, you have to look at the fact that dehydration. Once you are dehydrated and you do not take an adequate amount of liquid, your urine output decreases. And when your urine output decreases, any nidus of infection, either in the kidneys or in the urinary bladder, the bacteria or whatever is the bug has a propensity to grow. And because of this, you have a lot of urinary tract infections, especially in women. Primarily, the other thing you have to understand is because of the lack of public toilets or even in offices, because of the lack of hygiene, women hesitate to use the toilet. And invariably, when I get a woman with a urinary tract infection, I question them whether they have been using the toilet frequently, and most of them say no. We try and avoid going to the toilet because of whatever reason. It's unhygienic, we can't use it, etc. And this holding back of the urine itself, you see, urine itself is a very good nidus for growth of any bacteria, and that is why you have a rising trend, especially in the summer.
Hmm. Hmm. Yes, so there is, a lot of increase in incidence. And sir, how does, a polymicrobial urinary tract infection, causing a lot of rise in the current situation? So how does doxycycline work in that situation, sir?
You see, you must understand that most of the infections are polymicrobial in nature. Most of the
Okay.
urinary tract infections.
Hmm.
Even in hospitalized patients, you have polymicrobial infections because of catheter-induced infections, because of film in the catheter, etc. So they are polymicrobial in nature. Now, most of these high-end antibiotics are not going to act on any polymicrobial tissue at all. They are going to act specifically on that specific bug, say Klebsiella or Pseudomonas, etc. Very fortunately for us, doxycycline tends to act on multiple flora. Therefore, it's very effective and very useful in any polymicrobial infection. For example, it acts very well even in Pseudomonas infection. It acts very well in Klebsiella infection. So when you have community-acquired infections, especially in the outpatient area, in the outpatient domain, this drug is excellent because you do not have to wait for culture. You get a urinary tract infection, you start treatment immediately. That's why this drug is extremely effective. And I remember the time when perhaps this was one of the two or three antibiotics which we had available when I was doing my residency. And it surprises me, it shocks me, and it gives me great pleasure to understand that the same drug is now coming back in a different avatar, and it's so damned effective.
Yes, yes, sir. So, sir, here now, considering you mentioned about, in your residence, you just had 3 to 4 antimicrobials, to work with. And then there was a sudden rise of newer antibiotics coming into the picture, and,
That's
people, doctors overusing it, and, irrational use of the antibiotics leading to the antimicrobial resistance. So, sir, what do you think, was the reason behind this antimicrobial resistance, and how does doxycycline fit in this era of antimicrobial resistance?
so it's very simple. See, primarily understand that tetracyclines and doxycyclines have not been used for quite some time, at least until 12 to 18 months ago, when we
Hmm.
started using them a little more frequently.
Hmm.
Until then, it was the era of the super specialized antibiotics, and
Hmm.
unfortunately, the fault lies with the doctors as well as the pharmaceutical companies for plugging the sales of their antibiotics. So
Hmm.
you have a general practitioner who uses cefoperazone sulbactam without understanding the logic behind it.
Hmm.
You have a non-MBBS general practitioner
Hmm.
who would be using ceftazidime without understanding that this is an antibiotic which is reserved for pseudomonas infection. You will
Hmm.
find doctors using drugs which are acting against gram positives in gram negative infections and vice versa.
Hmm.
Under those
Hmm.
circumstances, you are going to get antibiotic resistance. This
Hmm.
is a bugbear which is growing, and it is a faulty treatment that we give, because
Hmm.
antibiotic resistance is bred one by giving the wrong antibiotics, giving the wrong antibiotics to the wrong patient, giving the
Hmm.
wrong dose, curate,
Hmm.
not completing a dose, or even
Hmm.
taking the dose over and above what is necessary. So
Hmm.
all these gives rise to antibiotic resistance. And now
Hmm.
more and more people are realizing, at least the corporate hospitals are coming in and having their hospital committees for antibiotic resistance. I'm the chair
Hmm.
of the infection committee of this hospital. And let me tell you, we try and keep it very strong. But then there's the ego hassle of every doctor, that if I
Hmm.
say this antibiotic I'm going to use, I'm going to use it. Now,
Hmm.
it's very difficult for my poor microbiologist because he's relatively junior, so they just buzz him off. And
Hmm.
ultimately, sometimes I have to step in, and try and explain to the equally senior consultant that, look, what we are doing is for the benefit of your patient and for the benefit of the hospital. And that is why antibiotic resistance is so important. Now, coming to your second part of the question, how does doxycycline fit in? Because this drug has not been used for so long,
Hmm.
right? We have found it to be extremely effective against most of the species. And
Hmm.
that is why even in our ICUs today, madam,
Hmm.
we use a lot of doxycycline. For very bad infections, we use a lot of doxycycline. Yes. In fact, the
Hmm.
tetracyclines are perhaps our last drug of choice, minocycline or doxycycline. And we use
Hmm.
it very frequently, and we found them to be extremely effective.
Hmm. Hmm. Yes. So, sir, since you mentioned about doxycycline now coming back and showing the effectivity, so sir, do you think that in this current era of antimicrobial resistance, even WHO has classified doxycycline in the access category, which is having the very least resistance to least potential for
This
resistance, and
potential
can be
for
used for.
resistance.
Yes, and what can be used for multiple infections. What is your take on that?
Absolutely, absolutely. But then again, I don't want you to go overboard. I don't want to lose doxycycline. Remember
Hmm.
that your pipeline for the drugs is very limited. You have
Hmm.
very few antibiotics in the making, and
Hmm.
therefore God has given us an opportunity with doxycycline and with tetracycline. Let us not indiscriminately use it.
Hmm.
Let's not use it for a small abscess.
Hmm.
Let's not
Hmm.
use it for a furuncle,
Hmm.
right? Let's try and avoid using it for this, because that would give rise to antibiotic resistance. But
Hmm.
yes, I accept it fully that this is a drug which can be safely used for a
Hmm.
wide variety of organisms and with
Hmm.
less propensity for developing resistance, at least as of now.
Hmm. Yes. So great. This was, really great interaction with you, sir, and beautifully described all the commonly occurring infections. And sir, here also I would like to know. You mentioned about pneumonia. So in what cases of pneumonia has doxycycline shown effectivity, and is there a rising incidence of pneumonia, especially in the summer seasons?
Yes, we do get a lot of pneumonias coming into the summer, especially the community acquired pneumonias, which are quite
Hmm.
common. Uh, the CAPs, as we call them, community acquired pneumonias, are usually very susceptible to doxycycline.
Hmm.
And I found that drug to be extremely useful. Again, a
Hmm.
judicial use for a judicial period of time,
Hmm.
goal directed therapy, and it works.
Okay. Great, great. So, sir, yes, now beautifully we've covered most of the summer commonly occurring summer infections, and how doxycycline acts effectively in all the indications, and also the importance of correct dosing and correct antimicrobial to be given for the infections that are occurring in the country now, with the rising incidence of antimicrobial resistance. So, thank you, sir, for such a wonderful discussion. And I look forward to having more such discussions.
One
Yes,
more
sir.
thing,
Yes.
Shweta. I think that we should, or you should perhaps bring to the notice of your audience, is the usefulness of doxycycline as an adjunct in typhoid fever,
Hmm.
not as a primary drug for typhoid fever, but as an adjunct in the use of typhoid fever. We find that a lot of patients with typhoid fever sometimes do not respond initially to
Hmm.
ceftriaxone, even in the
Hmm.
full dose of 4 grams or so. Right? It
Hmm.
is in those patients where when you add doxycycline, it seems to
Hmm.
work wonderfully.
Hmm. 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 Yes. Yes.
Yeah.
Great. Great. So, sir, here another indication of doxycycline and how it works effectively. So, thank you so much, sir. And sir, final message that you would like to give to the viewers who joined us today.
Well, I would like to say this. Thank you for listening to me. Uh, don't take my words for granted. Please read up also. At the same time, please use antibiotics judiciously.
Hmm.
Please prevent this horrendous rise of antibiotic resistance. Think before you start an antibiotic, whether it is necessary or not. And that
Hmm.
is my take home message. Because we have got this new antibiotic, it has got a new life. Try and not prevent it also going the same way as our higher end antibiotics. Here, I'd like to mention that in some of our institutions, we have a carbapenem resistance rate of 60 to 70%. What do you do after that? It
Hmm.
is
Hmm.
horrendous in hospitals.
Hmm.
So, if you wherever you can have judicial use of antibiotics, it would help considerably.
Great, great. This is like a learning lesson for all the viewers who have joined us today, and I thank you, sir, for sharing your insights. And I hope that the message of judicious use of antimicrobial is taken seriously by our viewers who have joined us today. Thank you so much, sir. Thank you for
Thank you, thank you,
such a
thank you, thank
wonderful
you,
interaction. Thank you.
thank you.